ADHD is a neurodevelopmental disorder, meaning it's not a disorder that shows up when you're an adult. You should have had symptoms since you were a little child.
Oh, wow.
Yeah, it's not oh my gosh, I was fine up until 3 months ago. I started having difficulty focusing, impulsivity, inattention. It doesn't happen like that. When we are looking at ADHD cases, right, timing is critical. When was the onset of symptoms? When did you start noticing your symptoms? There are people that have struggled with undiagnosed ADHD, especially for us Africans.
When you tell someone you're having pains in the body, they ask you how you're doing, they check up on you a lot of times. But when you say you're having an emotional breakdown, your family, your friends sometimes, your community, they feel like it's just a normal thing. There needs to be a lot of awareness towards mental health education and making people understand that there's a lot that has to do with the mind.
Here in America where we live, there's so much awareness, there's so many initiatives surrounding mental health, but there's still so much shame and stigma tied to it.
Hello. Welcome back to another episode of the Inside Zone podcast. Happy New Year to you once again. And today we are going to be having a conversation that we've avoided so long, and it has to do with mental health. You know, when you tell someone that you're struggling with a pain, you have a headache, they show concern. They ask you how you're doing. But when it comes to the issues of the mind, you tell someone you're having an emotional struggle or you're having a breakdown, they tell you it's normal. And so today we'll be talking about that silent struggle that has to do with mental health, because a lot of people are going through this pain in silence. They're not talking about it because when they do, they know they're going to get shrugged off. And joining me on this episode today is someone that is personally and deeply invested in the space of mental health. And my guest today is Dr. Mariah Eze. She's a doctor of nursing practice, and she's also a board certified psychiatric mental health nurse practitioner. Dr. Mariah, it's so wonderful to have you on the show today.
Thank you so much, Kenny, for having me. I appreciate it.
Oh, you're welcome. You know, quite a while now, I've been reading a lot of books that has to do with the mind, that has to do with my mind, because I noticed that if I'm not like mentally okay, then every other thing follows. But when we look at it in the African communities, this has been ignored for so long. And like I said, when you tell someone you're having pains in the body, they ask you how you're doing, they check up on you a lot of times. But when you say you're having an emotional breakdown, your family, your friends sometimes, your community, they feel like it's just a normal thing. And I'm just going to read a little stat for us here. They said nearly 150 million people in Africa are living with mental health conditions. And they said 1 in 4 people will experience mental illness in their lives, costing the global economy an estimated 6 trillion by 2030, according to the WHO. That's really serious. Why do we have this gap between physical health and mental health in the African communities?
That's a very interesting question. But before I answer your question, I also wanted to kind of touch on the the statistics that you just referenced. I don't even think that is accurate. I think,
Oh, wow.
yeah, because think about it. We don't have accurate data in Africa.
That's true.
There's so many situations that are not even being reported. So this is what is being captured. Imagine the other ones that are not being captured. So if there was good, accurate data, I think the numbers would be much higher. So this is something that we need to really be paying attention.
Right.
But then back to your question, I think it's multifactorial, right? We're talking about the African community here. So there's a lot of things that kind of come into play when you talk about Africans and how they perceive mental health. The first thing is culture, right? Our culture, we're very religious, whether be it Muslim, whether be it Christian, we're very religious. Our faith is part of who we are, it's part of our identity. And just based on how we were raised, we're raised to be strong, we're raised to not show weakness, we're raised to not talk about, mental health issues because there's so much shame, there's still so much stigmatization tied to it. Then when you flip to the religious aspects of things, everything is spiritualized. So if somebody's going through a mental health struggle, rather than them, seeking help, they go to their pastor, or their religious leader, who lays hands on them and prays for them and tells them you're healed. We believe, I'm a Christian, you're a Christian, so we
Right.
believe in the power of prayer, we believe in the power of, anointing, is in the Bible. So we believe in all of that. But I think there is a lack of awareness, a lack of education that also affects us as Africans, where we're not talking enough about mental health. People are struggling and it's so much hush hush about it. So I think the biggest why we have that gap is because of lack of education, lack of awareness, a lot of stigmatization that is kind of surrounded around, tied to it, basically.
And that's why we're even having this conversation
Yeah.
in the first place.
Yeah.
Like, there needs to be a lot of awareness
Yeah.
towards mental health education and making people understand that there's a lot that has to do with the mind.
Yeah.
Like I said, I've just been studying and it's so fascinating just knowing about the mind. What are some of this? We mentioned education, the cultural beliefs, also the spiritual beliefs, as well as some of the reasons why a lot of people are just, not taking mental health serious in African communities as well. But I want to basically also ask, why do we globally, even not just in the African community, why do we misunderstand mental health so much?
So I think over so many decades and years, and there's so much focus on the physical aspect of our health,
Yeah.
right? Like you mentioned, it's easy for you to tell somebody I have a headache, or I
Yeah.
have high blood pressure, or I have diabetes, please pray for me, or do you have any doctors that I can see? But when it comes to mental health, there is some kind of shame, right? That is attached to it. And I think that's why even globally, even here in America where we live, where there's so much awareness, there's so many initiatives surrounding mental health, where like America is really ahead when it comes to mental health initiatives and things like that, and resources, but there's still so much shame and stigma tied to it. So I think until we start to drive conversations that destigmatize people that are struggling with mental health issues, and for us to prioritize mental health and also educate people that your mental health is as equally as important as your physical health, we're always going to have we're always going to struggle. We're always going to have people that are not seeking for help because of, lack of awareness and lack of education.
That's totally true. I agree with you.
Yeah.
And I just remember that a friend of mine who was going through an emotional struggle, like he had a break with his relationship issues with his girlfriend. Then I think he was talking to his family about it. And then his mom told him that, come on, you get over it. But it was deeply affecting him. So for me, I feel like there must have been something mm, deeply more than that. But I also know the flip side of this, that personality traits could sometimes show off as mental health symptoms. For example, someone like me, there are times I like to isolate myself. I just like to be in my
Yeah.
space by myself. Does that mean every time I tend to isolate myself, am I struggling mentally?
Not necessarily. When people ask me questions like that, I throw back another question and ask, why are you isolating? Right? If you're isolating to just disconnect, recharge, recuperate, you just need, to gather yourself and come back.
Right.
Yeah, then that's fine, because I think we need that. There's so much, we're overly stimulated every single day of our life. So sometimes, depending on your personality, you may just want to step back a little bit, regroup, and then, be back into your social fold. But if you are isolating because you're sad, you're depressed, you're going through something, you're anxious, there's something going on in your mind, then that is a reason to be concerned, because self isolation would lead to other things. If you are struggling with a mental health disorder, if you're self isolating, you're more at risk of drinking privately, you know what I mean? Or smoking marijuana or doing drugs privately. So why are you isolating it? I think is the key thing, as opposed to you just isolating. Because anybody can take a break and just, disconnect. So
Uh, True. Even though that's I'm not paying for that clinical perspective that you just gave me. I think it's something that has always, been on my mind to
yeah.
just
No, I think
know if like, because
yeah.
I remember when I was like still talking about this. I remember when I was like living in South Africa, during COVID period. Pre-COVID, I was a social, I won't say animal, let's put it that way. Like I like to go out a lot.
Yeah.
Then after COVID, I noticed I just want to be indoor most times. And I think, what do you think might have sort of like caused that change in lifestyle? Could it be that I'm growing up?
I mean, again, it's a number of things that could have caused it. So when you were pre-COVID, you said you were more socially, were
Yeah.
going out and
Yeah.
everything, and COVID happened,
Yeah.
and you were by yourself,
Yeah.
right? Did you live alone? Did you have
Yes, I
roommates?
did. I
Okay,
did.
so you lived alone for 2 years,
Yeah.
right? They said it takes about what 3 weeks to form a habit.
Oh,
So,
true, right?
so you were by yourself for 2 years, and maybe those things that probably were interesting to you are not that interesting to you anymore. Maybe priorities have changed. Maybe, you have a different focus in your life. But I don't think it's anything significant because COVID changed a lot of people. I mean, this was a pandemic that affected the whole world. So a lot of people changed certain things about their lives
True.
for the better and some situations for the worse. So I think it's the pandemic did a lot of things to a lot of people. So as long as you are not struggling in silence, right? You just have a different perspective in life. You're not really out there anymore. You still need to have a social life, though. It's important for your mental well-being.
True.
So just make sure that you're not just disconnecting from human connection, because that's critical.
Thank you so much. Like I said, I'm not paying for the clinical perspective.
Send you a bill.
Okay. You know, so what I was going through is possibly a personality issue combined with like what happened in the world 2021, 22. Now, is there a difference between my personality and psychotic disorder, for example?
Yeah. So I think it's interesting to understand what psychosis
Okay.
is in and of
Yeah.
itself. So the best way to put it without being super technical is to tell you what some of the symptoms of
Okay.
what a psychotic disorder or psychosis would look like.
Great.
Right? Example of that would be somebody having auditory hallucinations, meaning hearing voices that nobody else can hear, having
Wow.
internal dialogue with
Wow.
yourself, internal stimuli, right? You're responding to things that nobody else can see, visual hallucinations, seeing things that are not there.
Visual hallucinations.
Yeah. So people would see like bugs crawling all over. That's like, we call that tactile, like if you feel like bugs are crawling all over your body. But visual hallucinations, they can see like, oh, do you not see the cats running up and down? Or do you not see these two people standing here? Those are like examples of visual hallucinations. Another example of psychosis would be like delusion, like people just believing that the FBI is after me, like,
Oh,
or people are listening to my conversation and things like that. You know what I mean? So those would be examples of like a psychotic episode or psychotic disorder or psychosis. So that's different from personality. Now in psychiatry, we also have like personality disorders,
oh, great.
like borderline personality
What does that
disorder.
mean?
So this it's more of a behavioral thing,
Yeah.
right? But it is a mental health issue as well. You know how people would have like I mentioned, borderline personality disorder, narcissistic personality disorder.
Right.
Sometimes you're able to say, "Oh, he's a narcissist. He's a narcissist." I'm like, but there is a criteria to actually to meet for you to be considered a narcissistic person. There's different personality disorders that we have in psychiatry. There is a difference between that and psychosis for sure.
Oh, great. That's
Yeah.
so good to know. And I want us to basically talk in a broader perspective. Let's imagine someone watching this right now and they want to know if they have the signs of mental health issue or emotional struggles. What are some of those signs that would creep in or show up in
That is a very good and a very complex and
right,
broad question
interesting. Okay.
because there's different mental health disorders. There's a lot of mental health disorders, right? But I'm just gonna talk about the ones that are kind of common, right? Like anxiety disorders, major depressive disorders, and I'll talk about the common signs and symptoms that people may experience.
Brilliant.
So, for example, for major depressive disorder, for you to meet criteria for them to diagnose you with depression or major depressive disorder, as we call it clinically, you must have experienced these symptoms that I'm going to talk about
Right.
for at least 2 weeks consecutively. And there's about 9 symptoms that we usually look out for, and the person must have at least 5 of those symptoms.
Hmm.
So the first one would be, say, lack of motivation. So you used to be motivated to, say, for example, go to the gym,
Interesting.
hang out with friends. Yeah, lack of motivation is a
Oh, wow.
symptom of depression. Inability to not be able to get out of bed, go to work, lack of motivation to do anything that you typically would have enjoyed doing. Lack of interest, like anhedonia is what we call it. Like, for example, you used to, now you don't have that, but you used to hang out with friends, you used to
No, I'm more intentional about it now.
yeah, exactly. So maybe you used to like love playing soccer, but now if you even talk about anything soccer related, you're not even, you have this flat affect, no emotions towards it. Um, Another symptom would be difficulty sleeping
Okay.
or sleeping too much. So
Hmm.
hypersomnia or insomnia,
Wow.
right? So for some people, when they're depressed, they sleep too much or they don't even sleep at all. Another symptom will be changes in appetite. So for some people, they eat too much when they're depressed, emotional eating. For others, they have lack of appetite. They can't even eat anything. Difficulty focusing. So think about it. If you're depressed or if you're anxious, if you're worried about something, it's hard for you to focus and make executive decisions. It's hard for you to, have a conversation. It's hard for you to focus on anything, whether it be at work, school, or just interactions at home. Hopelessness is a big one. Feeling like you have no hope. There's no, nothing to look forward to in life. And the big one that I usually like to point out is thoughts of suicide.
Hmm.
Yeah. So people that experience depression or any kind of mood disorders like bipolar, whether it be bipolar 1, bipolar 2, will experience suicidal ideations and in some situations may have attempted suicide. So those will be the symptoms. Now, for anxiety specifically, if you experience any of the symptoms I'm about to talk about for at least 6 months or greater, you definitely want to see somebody. Excessively worrying, people that experience what we call catastrophic thinking. So, for example, I call you, you don't pick up. I'm like, Kenny obviously doesn't want to pick up my call.
Oh, wow.
Something must have happened to him. Maybe he, that's what we call catastrophic thinking, worst case scenario type thinking. If you experience irritability, like very easily, you get irritable easily. If somebody annoys you, you have exaggerated response for something basic that they did, right? That is a sign of anxiety when you're easily irritable. Um, Difficulty focusing. Sometimes people would think, oh my gosh, I think I have ADHD because they're not able to focus, but it's because they're worried about something. And then, of course, you see how the symptoms kind of overlap. Difficulty sleeping. If you're worried about something, it's hard for you to sleep, it's hard for you to kind of relax and go to bed. So, those would be like some of the signs to be concerned about. If you do notice any of the symptoms, you definitely want to talk to a professional.
Yeah.
Now I'm not going to talk about the deep ones like the bipolar disorders and the schizophrenia symptoms,
Yeah.
but those ones are, more of the psychotic episodes that we mentioned earlier.
That's
Yeah.
interesting. For our listeners listening right now, you need to share this link with anyone that you know that might be struggling emotionally or mentally. Even you don't need to be struggling emotionally to understand what we're talking about today. I believe this information, this conversation, will generate insight that is going to change someone's life. And so please share with someone also listen on Apple, Spotify, or podcast. And so, Dr. Maria, a lot of African communities, we don't talk about mental health.
Yeah.
We think everybody is okay, you're fine. From a professional and clinical perspective, what does it mean to be mentally okay?
Stable. I gotta point this out because life happens.
Right.
You're not gonna be 100% happy every single minute of your life. That is not sustainable. I mean,
True.
life happens. People lose loved ones, they lose their jobs, they lose whatever it is that can cause them to be sad, and that's fine. That's an emotion. But when it becomes so severe that is impacting your day-to-day functionality. Say, for example, you're unable to get out of bed, you're unable to go to work, you're unable to do anything school related, or you're dropping out of school. If it starts to impact your day-to-day, that's when it becomes an issue, honestly. But what if is a stable mental health would look like? I like to address it from a holistic standpoint.
Okay.
I think it's when you are spiritually stable,
Right.
physically stable, like healthy, and emotionally just stable, right? You're not having what we call labile emotions, up and down. One minute you're high, next minute you're low. Like your emotion is just kind of even kill, basically, is what I would consider a stable mindset.
Yeah, that's so good.
Yeah.
And as you were talking, I was just thinking about, I saw a picture and I think Twitter the other day, and I said, you need 3 wins every day when you wake up. You need a spiritual win, You need a physical wing, you need a mental wing.
Yeah.
And you just rightly mentioned those three areas to basically make the sum up of how we can be stable
Yeah. Holistically, from a
holistically.
holistic standpoint. Yeah.
That's good. And in African communities, do we have any early signs that people ignore a lot?
I mean, I think the signs are usually very glaring. We just don't know because, again, going back to the part of anything that is mental health related is
Yeah,
often chalked up to spirituality.
right.
It's always this. My uncle in the village is attacking me, or this they did juju, or they did jazz for me, or this person in the village is chasing my family. But honestly, it's important for us to know that mental health disorders do run in the family. There's a strong genetic component
Oh,
to it.
really?
Yeah, it really does run in the family, unfortunately.
So,
It's all in the genes. Yeah,
oh,
there's a
wow.
strong gene. Yeah, absolutely. So, for example, if a family member, a blood relative, right, experience, say in Nigeria now, because we don't know, because we don't know what our psychiatric mental health history here looks like. You know, like if you go to the doctor, like a medical doctor,
Right.
they would ask you family history, any history of high blood pressure, any
Yeah.
history of diabetes. We do that in psychiatry too.
Oh.
It's just that we don't know our family psychiatric history because nobody talks about it. But if you think back, typically I would ask a patient, especially if it's an African patient or an African American patient. I don't ask them any history of bipolar depression. I mean, I would ask some patients that may know, but for others that I feel like they don't know what their family psychiatric history looks like, I would ask them, anybody attempted suicide or committed suicide in your family? Anybody just ran away, just became crazy, in quotes, just started talking to themselves or started self-isolating or drinking too much or doing drugs or those are things that they'd be like, oh, I had this one uncle that they put him in a psych ward for, a year because he was, crazy. That gives me a clue into there is probably a history of something going on in the family, right? So if the patient is now manifesting similar symptoms, we can now make that connection. So it's important for us to know, if you don't know what the diagnosis is from a psychiatric standpoint, it's important to ask questions, ask your parents questions, like, did anybody, especially if you are experiencing certain symptoms, did you experience, mommy, when you were pregnant with me or with any of my siblings, were you sad? Did you experience sadness, depression, inability to do anything? Or when you had me, did you experience depression, sadness? That's postpartum depression, right? And studies have shown that people that or women that experience postpartum depression are at risk for mood disorders,
Wow.
right? So we need to screen that. So I think knowing, you may not know the clinical term, but notice asking questions about signs and symptoms like, did somebody run away? Did somebody run mad? Did somebody try to commit suicide or actually commit suicide? Is there an alcoholic in the family? Things like that cue us into, okay, maybe there is a family history of some kind of psychiatric disorder. So family history plays a critical role that people need to know. Um, Other things like environmental, unfortunately, right? It's Africa. Things are hard.
Ah, poverty.
Poverty,
Oh,
goes back to what we call social determinants of health. There are certain factors that can impact mental health as the same way that we impact physical health, right? So, for example, lack of education, like an illiterate, illiteracy can increase your risk for mental health because you don't know to eat healthy, you don't know to exercise, you don't know to do lifestyle modifications that can better your mental health, right? You don't know that consuming alcohol can actually mess up your whole mindset and your body and your health in general. So those things play a role. So there's environmental factors and there is biological and genetic factors that can affect mental health
yeah.
disorders.
And from what I heard you just talk about, you spoke about the biological aspect, the environmental,
Mhm.
and poverty, the social.
Yeah, the social determinants of health. Yeah.
That's interesting to know.
Yeah, unfortunately, but that's the truth.
Yeah, but also on the flip side, you know, there were cases of people that were doing financially okay.
Mhm,
Like I had this news of someone like there's this well-known, globally respected cook, Anthony Bourdain,
mhm,
and also there's a comedy actor, Robin Williams, that was diagnosed with, I think, dementia,
mhm,
and he later committed suicide.
mhm.
And that just basically made me realize that not everyone that is doing okay financially is
Yeah.
okay. as well.
That's a very good point. So remember, as I mentioned, the social determinants of health, when I mentioned poverty,
Yeah,
is a risk factor. It doesn't, there are people that are poor and exceptionally happy,
yeah,
right?
right.
And there are people that have all the money in the world and they're depressed. There's nothing you can do to them to snap them out of that depression. So it goes to show that mental health disorders does not discriminate. It doesn't say because you're rich or poor. If you're genetically predisposed to it, you will, it doesn't mean you're going to have it, but if, you know, other factors kind of come into play and things align, you may develop a mental health disorder. But there's no, it's not for rich or for poor people. It's kind of like when we had that whole big campaign in Nigeria about AIDS, no, they show for face. Mental health disorders are like that. Like it can affect anybody, to be honest with you.
Mm,
Yeah.
interesting. And I was just reading some stats recently, and before that, could hormonal imbalance also trigger some of these symptoms and signs in the body as well?
Yeah, I mean, there is a role for, there is a role that hormonal imbalance plays, right? But the thing that so for example, if a patient comes to me,
Yeah.
and they are experiencing lack of motivation, fatigue just means excessive tiredness, um, and then just, not feeling, just sad, unmotivated, not wanting to do anything. I like to run some blood tests because there are some hormones that we like to check, like thyroid hormones. If the thyroid hormone is low, it can mimic symptoms of depression.
Oh wow.
Yeah, and then vitamin D levels as well if they're low. I know in the African part of the world, because we receive sunlight, we're always out and everything.
Yeah.
People don't really have a lot of vitamin D, low vitamin D levels like we have here, in the States. But I like to check the vitamin D levels. I like to check their thyroid levels because those are easy fixes, right? Um, their thyroid levels are low, you just refer them to their primary care and they put them on medication to help bring it, stabilize it. Same also if they have low vitamin D levels, it's either they get it from diet or we give them supplements. But as a woman, there are issues, because we're
Yeah.
hormonal human beings, and we do experience, when there's fluctuation in the hormones, especially during our cycle, we can experience mood changes.
That's true. I didn't say that.
So I mean, you hear people say, "Oh, you're PMSing, you're PMSing." So it can happen during, changes in cycle when somebody's pregnant or when they just had a baby. You can sometimes you see what you hear what we call postpartum blues, where a woman is
Yeah.
just crying, they're just sad, and they can't even explain why.
Yeah.
It's just because of the hormonal changes and the shifts in the hormone. But a lot of times when the hormones are, corrected or stable, they should be fine. But if they're still having symptoms, then it's not more so of a hormonal thing, it's more of a psychiatric situation going on.
It's so good to know the difference between what you just explained to us, right?
Yeah.
Yeah. So I was reading a stat recently, and I'm just going to read it for us. They said there's been surge in ADHD among adults. They said the claims for ADHD increased by 101% among 18 to 44 years old, 70% among 45 to 64 years old. And there's been unprecedented increase in, we can see it in the world, in burnout, anxiety, and exhaustion. And so that brief showed us that there's been a surge in this ADHD among adults, for example. From your perspective, what do you think is driving this surge?
So,
It's
ADHD is,
complex, right?
it's an interesting topic because it's important for us to understand that ADHD is a neurodevelopmental disorder,
Hmm.
meaning it's not a disorder that shows up when you're an adult. You should have had symptoms since you were a little child.
Oh, wow.
Yeah, it's not a, oh my gosh, I was fine up until 3 months ago. I started having difficulty focusing, impulsivity, inattention. It doesn't happen like that. So when we are looking at ADHD cases, right? Timing is critical. When was the onset of symptoms? When did you start noticing your symptoms? Now, there are people that have struggled with undiagnosed ADHD, especially for us Africans, where they literally beat ADHD out of you.
Yeah.
Like imagine an elementary school child that is bouncing off the wall, not
Yeah.
paying attention. They just think, oh, this person is stubborn, right? They may have been exhibiting symptoms of ADHD. Now as adults and there's more awareness, no thanks or thanks to social media,
Yeah.
you can go on TikTok now and be diagnosed with ADHD. um, People are getting are becoming more aware of what the symptoms look like, and they're going, "Oh my gosh, that looks like me. These are the symptoms I've been experiencing, so now I can put a name to it." So that's why it looks like there's this surge. Secondly, again, timing is critical. Like I said, there are 3 diagnoses, but there can be more, but there's 3 main diagnoses that have what we call overlapping symptoms,
Okay.
meaning they look like ADHD, but they may not be ADHD.
Yeah.
One of them is anxiety.
Because I get, sorry to cut you short
Yeah.
again, but a lot of people say, "Oh, I have ADHD. I
Yeah.
have ADHD."
They throw the word that diagnosis so loosely that it's unfortunate. People that actually now suffer from ADHD are not getting like the help they need as
Right.
fast as possible, because everybody and their uncle now is diagnosed with it, has ADHD. Even people that clearly don't have ADHD are now saying I have ADHD, because and there's so many things causing it. Let me just, before I lose my train of thought, I was talking about the 3 diagnoses that have overlapping symptoms:
Yes.
ADHD, anxiety, and bipolar.
Right.
So anybody that has bipolar, anybody that has anxiety will experience difficulty focusing. Now, does it mean they have ADHD? No. However, 50% of patients that have bipolar will also may also have ADHD as well. So they may have both diagnoses, ADHD and bipolar. Now, another thing that makes it look like people are having attention span, or impulsivity or hyperactivity. Hyperactivity is usually seen mostly with children, because as adults you've learned social norms, so you're not like bouncing off the wall. But honestly, social media has a lot to do with it, right?
Interesting.
Because
Right.
everybody, that dopamine hit,
Yeah.
you know what I mean? I give me to me in 5 seconds. Anything after 5 seconds, I'm not paying attention anymore, right? So I like to ask my patients, when did your symptoms start? Because not everything that looks like ADHD is ADHD. However, there are adults that were not diagnosed as children, and now that they have more responsibilities, school, work, life, everything, the symptoms are manifesting more, and those people should be treated accordingly.
True. Right. And just talking about social media, I've had my own hit of dopamine severally. I remember there was a time I couldn't get my hands off the phone.
Yeah.
And so I discovered a book. It's called Deep Work by Cal Newport. And I read it. And the book says, attack the first 4 or 5 hours of the day. And you can basically rearrange the remaining part of the day around what you need to do. And I noticed that when I stopped using my phone and concentrating on what I needed to do, I was more productive. I was more focused. But more than that, I felt at peace.
Yeah, I agree with you 100%. I think we underestimate our brains,
Right.
right? And think about your brain as like a muscle. If you don't develop your muscles, if you don't use your muscles, you lose them, right?
True.
The same thing with your brain cells. If you're not stimulating your brain to it's like neuroplasticity, to learn new information, to memorize things, it's gonna be hard for you to hold any, you know what I mean? Like back in the day, I remember I used to work in the bank a long time ago in
Interesting.
Nigeria. Yeah, when I finished my youth service, I would memorize account numbers, customers' account numbers, a lot of them. Like as soon as they're walking in, I already know the account number. I'm punching it in because I memorized it. Today, I can't even memorize. I don't even know my daughter's phone number, because everything is like it's saved on my phone.
Yeah.
So I'm not tasking my brain.
Yeah.
And if you're not exercising your brain like that, it's gonna look like you're not gonna be able to focus. You're not gonna be able to, recall information as fast as you should. But our brains, that we really underutilize our brains. So I agree with that. I usually tell my patients that the first hour of your day is critical. And also started practicing that. When I wake up in the morning, I do not touch my phone. I do not look at my phone, because once I look at my phone, I get distracted.
True.
Because you can get one text or one phone call or something, and your day that just
It's gone.
dictates the trajectory of your day. So the first hour of your day, what you do in that first hour is critical and can make or break your day.
And I'll just ask you
Yeah.
from your own perspective, what do you do in that first
Yeah,
1 hour?
absolutely. So the first hour, the first 15, 20 minutes of my day, because I'm a Christian, I'm praying, I'm
Yeah.
trying to read the Bible, even if it's just a verse, I'm reading something. And then I exercise. And when I'm exercising, I am actually learning new information because again, I gotta stimulate my brain.
Yeah.
So I listened to this guy Napoleon Hill on YouTube, who is
Oh,
amazing.
yeah.
I love that guy.
Me
So
too.
I'm learning. He's just amazing. So I'm learning new information. So the best thing is always to pair a habit with another habit, right? So I'm exercising, I'm releasing dopamine, I'm releasing serotonin in my brain, and I'm learning new information at the same time. So that goes there. There goes my first hour. And once I do that, my day is I feel like superhuman. I can conquer the day. Right. So that's what I typically do. And that's what I prescribe to my patients if they can to
Mm,
do.
That's really good
Yeah.
because I do the same as well. It's
That's
really honest.
awesome.
Yeah, I do the same as well. And I just want to backtrack a bit. You were talking about not being able to memorize phone numbers, and I remembered. I just remembered now that when I was in high school, we call it secondary school back
Yeah.
home in West Africa, Nigeria. My friends and I back then were using landline. It's called Starcoms.
Yes.
And back then, it was about 7 digit number. And I had a lot of our friends. They had us weekend free calls that we used to do. And I knew all their numbers.
Numbers. Yeah.
I knew
Yeah.
everything. I can still remember some of it right
Yeah.
now. But if I
But learning new.
knew
Yeah.
things now has
Yeah.
become so difficult, that means we've been overstimulated
Yes.
in the mind. And I know you've already touched base on one of the ways we can come into mental well-being is by reducing our usage of social media, the usage of our phone, the dopamine hits that we're
Mhm.
getting.
Mhm.
But I want to ask, when it comes to being in a state of mental well-being, what are some of the strategies that if a listener is listening to us right now and they're like confused about, oh, how can I get into that state of mental well-being? What are some of the strategies you would basically tell them to?
So I think there's quite a few things that you can do. One of the things that I want to touch on is your mind, right? I know Just Maya wrote a book about the battlefield of the mind.
Yeah.
And I think our minds are so powerful because the way I equate it is like a computer. Whatever you program in your mind is what is going to run. So if you program positive energy, if you program glass half full type mentality, if you program positivity, that's what your mind is gonna run. That's just the what is gonna regurgitate back to you. So if you program negativity, pessimistic mindsets, that's exactly what is going to feed back to you. So one of the things is just having a healthy mindset, the quality of your thoughts. What are your thoughts like? Do you allow your thoughts to run wild or do you challenge your thoughts? So one of the things that I teach my patients is what we call thought challenging. If a negative thought comes to your mind, do you let it dwell in your mind or do you kind of question the thoughts? Where's this thought coming from? Why am I having this thought? And then what I teach them also is once you challenge your thoughts, the negative thoughts, you got to replace it with something positive, right? So I think having good quality thoughts, number one, making sure that you are paying attention to your mind, you're feeding your mind with something with positive things is number one. Number two, lifestyle modifications like exercise. Exercise is critical. A lot of times I tell patients most of the antidepressants that we prescribe contain serotonin, norepinephrine. Some have dopamine in it. Our bodies make those. Like when you exercise, your brain actually releases all of those neurotransmitters. So exercise is critical. Adequate sleep. A lot of times people run on 5 hours of sleep and think that that is sustainable. We need at least 7 to 8 hours of sleep. So making sure that you're sleeping well, mindful eating. A lot of foods that we consume contain hormones, contains preservatives, contains things that kind of can mess up our moods. So making sure you're eating quality, healthy foods is critical. Staying hydrated and reducing your stress level. Stress is a big one, right? A lot of people are under immense stress. And I think just, Googling stress reducing strategies is critical for you. Whether be it at work, school, home, whatever it is, you want to make sure that your stress level is low, is really low.
Uh,
Yeah. So those would be some of the strategies, right off the bat that I would recommend. Of course, there's more technical, clinical things that we can do, like journaling, seeing a therapist, things like that. But yeah.
I like what you said about replacement principle because I was reading a book. It's called Winning the War of the Mind. And they talk about the replacement principle whereby you have to look at those thoughts that you're having and replace it with something totally different. And we might touch base on something I really want us to talk about before the end. But um, in African society communities, there's not that much dissemination of the information with regards to mental health. How can we raise that awareness more,
Yeah.
especially in the African spaces?
Yeah. I think like what we're doing now, so I commend you for even having me on your podcast.
Thank
I
you so
think
much.
talking about it, the more we talk about it, the more we shed light on it, the more people are educated. And thank God for, this era that we're in now, Internet of Things. Everything is online. Everybody has a device that you can access information on.
Right.
Social media. So I think the more we have conversations about it, the more we as Africans drive the conversation, drive the narrative that it's okay to not be okay, right? Destigmatizing mental health allows people that are suffering to actually reach out for help. I mean, think about it now in Nigeria, where attempted suicide is still a jailable offense. It's a punitive offense. You can be locked up in jail for about a
Wow.
year. Yes. How will somebody that is struggling, that is having suicidal ideations, feel comfortable to reach out? So these are some of the things that we're talking about. We need to educate people. We need to also tackle it from various aspects, from a policy standpoint, from a resources standpoint, from an educational standpoint, so people know that help can be available if you do reach out.
And that reminds me, there was someone that was recently arrested. Is a popular guy back in Nigeria. He
Yeah.
was arrested for trying to commit
Commit
suicide.
suicide, yeah.
And
Unfortunately, Nigeria is one of those countries that still does that.
that baffled me so much.
Yeah.
And one thing I have noticed in religious organizations, societies, I see we don't really talk about mental health, even in the church as well. I understand the place of the spiritual, but like I said, if your blood pressure is high, you pray about it, but you still make
Take your blood
some
pressure
lifestyle
medicine. Yeah.
advancements. So faith without works is dead
Dead.
already.
Yeah.
What can we do in religious environments, and what roles can those leaders play in making sure this awareness and sensitization and the dissemination of this information is readily available to people?
Yeah, no, that's a fantastic question. So I think that really religious leaders underestimate the influence and the power I mean, I think they do know. But when it comes to like mental health, they underestimate the influence that they have on their congregation, right? Because remember what I said in the beginning that faith is tied to our identity.
Right.
If you look at an African person, they're religious, whether be Muslim or Christian, their faith is tied to who they are. So if tone at the top is driving the conversation, if a pastor is on the pulpit and is talking about if you struggle with mental health, help is available, as opposed to saying it's a spiritual attack or is a sign of weakness, you should bind that demon. There's a place for that. But there are people that are still struggling in spite of all of that.
Sure.
So if a pastor or a religious leader is driving the narrative, is creating awareness, is normalizing the conversation within his or her congregation, people are going to be able to feel comfortable to have this conversation. So I think people in the place of authority, whether it be community leaders, faith-based leaders, they need to drive the narrative so that people feel comfortable to reach out for help.
Thank you so much for shedding more light on that. And I
Absolutely.
think it's absolutely right. They need to make people feel comfortable to
Yeah.
reach out because people are struggling. And
People are struggling.
yeah.
And even within the churches, even people that hold, spiritual titles are also struggling. Like I do have patients that are struggling and they have titles as well.
That even reminds me, someone like Elijah was burnt out
Yeah.
in the Bible.
I mean, Elijah was suicidal at some point
Oh.
when he was being chased out. I
Yes.
believe it was Jezebel was chasing.
Yes.
Yeah, he was suicidal. Job was depressed, severely depressed. Who was this guy in Lamentations that just lamented from the beginning of the book of Lamentations till the end? This prophet, I forget his name now. So there are cases in the Bible where people were severely depressed. David, at some point when he lost his son, was severely depressed. So I think we should normalize the conversations. I'm not saying that we should say, "Oh my gosh, you're struggling with mental health. You must, it's all just, you have mental." There is a place for prayer. Pray through it, but also provide the person resources that they need to kind of navigate that situation.
Totally true. We should pray, but we should also make sure there's enough guidelines
Yeah.
and the enablement and the awareness that would make them, take in or make sure that they keen into the information that
Yeah.
is available for them. And as we, continue, we're rounding up right now. And for someone that is listening right now, probably driving or just sitting down and soaking in all the information and looking at how they're going to modify their lifestyle and obviously practice a lot of gratitude and other some of the strategies that you've shared right now. Right. If there's someone that is struggling and still finding it so difficult, what would you want them to hear right now?
So I know no matter how I say it, that, there's no shame in having a mental health disorder. People still struggle with shame, but I want that person to hear from me. There is no shame to it. And actually, seeking help is a sign of strength because it takes courage for you to say to someone, I'm not okay. I need help. It's not a sign of weakness as much as how I know we were raised to think it's a sign of weakness is actually a sign of strength, to be vulnerable enough to say, I'm not okay. So if you're somebody that is listening right now and you are struggling, please find somebody that you trust and reach out for help because help is always available. You just have to reach out.
Three key things to pick up. You don't need to feel ashamed about it. Reach out for help
Yes.
and make sure you definitely talk about it
Yeah.
with a
Somebody that you
professional.
yeah,
Yeah.
absolutely. Or the professional.
Well, and if anybody wants to connect with you, probably after the show, and they need more information, because there's only a little we can share
Yeah.
on the podcast, how can they reach out to you?
So, for those that are in America, I am licensed in DC, Virginia, Maryland. So, you can definitely, reach out to me. I will provide my website
Okay.
for them to be able to contact me. But for those that are in other parts of the world, I think social media would be the best bet to contact me. I would also provide my social media handle and they can feel free to message me. I'm happy to talk about, as you can tell, I can talk about mental health all day. So if you message me, DM me, I'm happy to reach out and talk to you. And if you are in any part of the world, especially Nigeria, I would be able to find resources and connect you with somebody that can help. So
Thank you so much, Dr. Maria. And, getting to the end of this conversation, I've realized it's not just a conversation about mental health. It's about the stigma.
mhm.
It's about the silent pain that people are facing, especially in our communities
Yeah.
as Africans and Black Americans,
Yes.
the Black community as a whole, the stigmatization, the shame that comes with it, the emotional realities that we've been taught to suppress.
Mm.
And it's been so refreshing to have you on the show with us today. Thank you so much for.
Thank you so much. One thing that I forgot to mention was the place of medications. I know that a lot of people think taking psychiatric medications is, oh my gosh, is the worst thing that you can do. Lack faith, that means you don't have any faith, you don't trust God, and things like that. But you have no problem taking your blood pressure medication. You have no problem taking your diabetic medications if you're diabetic. Please understand that not every psychiatric disorder requires medication. We treat based on symptom severity. So if your symptoms are severe enough that requires medication, please do not run away from medications. There are so many amazing medications that can help provide you stability in life and increase and better your quality of life. So please, if you are in that position and they've recommended medication, medication works, therapy works. Reach out.
Well, thank you so much,
Thank
Dr.
you.
Maria.
Thank
Thank
you
you for
so much.
shedding
Thank you for having me.
spotlight on this. Thank you.
Yes.
Yeah, we have come to the end of the Insight Zone podcast. You read it all from Dr. Maria Eze. The stigmatization needs to stop. There need to be more awareness in the African communities and also in our religious organization and societies. And we've come to the end, and I do hope you share this episode with someone else and with your friends and family. Follow us on YouTube, Apple Podcast, and Spotify. And until next time, this is the Inside Zone. See you.